Hi Ninja Nerds, in this video we're going to talk about Raynaud's phenomenon. If you like this video, please give it a thumbs up and let's get started. So Raynaud's phenomenon, if you heard this before, you may have heard of it as Raynaud's disease or Raynaud's syndrome, but there's many different ways that we can delineate or talk about what Raynaud's is. But what we're trying to do in the medical field is move into primary and secondary Raynaud's. So let's just talk real quick what the difference is between primary and secondary. Primary, they're not really sure of the exact cause. There are triggers that we'll talk about and risk factors for primary, but we're going to just delineate here that we know that with primary, it's symmetrical, okay, which means that when we talk about the parts of the body, it's going to happen bilaterally or on both sides. And for secondary, it's going to be asymmetrical. And it happens secondary to a disease process. And a couple of those disease processes are lupus, rheumatoid arthritis, and scleroderma. Okay, so for the purpose of this video, we're going to talk about Raynaud's as a whole, but there is a delineation between primary and secondary, just so you understand that. But what is Raynaud's phenomenon? Raynaud's phenomenon is defined by this vasospasm, all right, that occurs particularly in our fingers, our toes, our nose, and our ears. Okay, and with Raynaud's, a vasospasm in the body is normal, but what happens in Raynaud's is it becomes very excessive, all right, or increases, or is a very, very strong vasospasm. And then we're going to talk about that today. So first, let's talk about a vasospasm. What is that? We have this arteriole, or this artery here, all right, and it's going, blood flow is coming through, but you'll notice that there is this narrowing here, right, this pinched in part. And we call that a constriction, right? So we have this vasoconstriction that occurs, and it's normal in our body for it to occur. We have a normal dilation here, and then we have this little bit of constriction here that's squeezing in. But what happens in Raynaud's, it is an excessive vasospasm, or this constriction that is occurring that is so strong that it almost takes away all blood flow. It decreases it so much, right? And why does this occur? Why does this occur in our body? Is this normal? Yes, vasospasm is normal, right? We know that this occurs in our body. What is the whole purpose of that? The whole purpose of a vasospasm is to decrease blood flow to that area, to preserve blood flow to our vital organs within our chest and abdominal cavity, right? So we're doing this to preserve heat, to preserve perfusion to all those organs. Why does it occur? So we have this constriction, right? When we have this vasospasm, we have a decrease in the blood. So we have a decrease in the blood flow to the area when it constricts. Because of that, we have a decrease in oxygen, and then that's going to cause our color change. And you're probably like, Kristen, what are you talking about? Why are you saying color change? Let's talk about the hand. Since in Raynaud's, the hand is the primary spot in the body that this occurs. It does occur again in the ears, nose, and toes, but it does occur in the hand, and it occurs most often in 3 fingers. We have right here our index, our middle, and our ring finger. So they occur typically in these fingers. And I'm talking about this color change because we're talking about this blood flow that decreases in oxygen that causes our color change. So if you look at these 3 fingers here, index, middle, and ring, you're going to see this one right here, which has no color right now. It's white. Then we have a blue finger, and we have a red. And just understand that this is going to occur in all 3 of these fingers or in the whole hand. It's going to go from white in all the fingers to blue in all the fingers to red in all the fingers. It's not going to be 3 different fingers with 3 different colors. So we have white, which is going to dictate what? We talked about a decrease in blood. So that blood flow is decreasing, so it's going to cause that pallor or that white coloring in the fingers. Then we're going to have a decrease in blood, and what does blood carry? Oxygen. So we have a decrease in our oxygen, which is going to turn it this blue color, which we call cyanosis or cyanotic. And then the last, we have red, which is a return of the blood flow. And when our fingers or any part of our body turns red, we call that erythema, right? So we have these three colors that are occurring in those fingers. Why is this occurring? It's because of that excessive vasospasm, that constriction of blood that's decreasing our blood flow in an excessive manner, which is going to cause this increase in color change. Okay. So let's talk about it. Why does that occur in some people? What's going on? What's making this occur? We have triggers that are commonly referred to in Raynaud's. We have a snowflake here, which is going to help us identify that as cold. We have a cigarette here for smoking. All right, and the last is going to be stress. And why are these triggers? Remember with cold causes constriction, or it's going to cause that vasospasm, that constriction to preserve blood flow, preserve heat to our central body and all of our vital organs and our perfusion in our vital organs. Smoking causes a vasoconstriction, which will then decrease the blood flow, and also stress, that fight or flight response. So all of those are going to cause that type of vasoconstriction or that decrease in blood flow to the area, which is going to increase heat and perfusion to the vital organs in the cavities of our body, our abdomen and our chest. So with these triggers, that can cause an increase in Raynaud's along with risk factors. And there's 3 risk factors that I want you to be aware of. I'm going to write these in a different color that really increase someone's chances of experiencing Raynaud's. One of them is being female, being young. So typically they say anywhere from 15 to 40 years old. Okay, and the last one is having a family history. Okay, so we have these 3 risk factors and these 3 triggers. So if you're a young female with a family history that is going out in the cold to smoke a cigarette and is under a lot of stress, you might have a flare-up of your Raynaud's. With that being said, let's talk about these signs and symptoms that can occur with Raynaud's. First, I just want you to realize it's a sudden onset. Again, this happens, they have a trigger, and it's going to happen pretty quickly. When they do have the sudden onset, this whole experience can last 15 to 20 minutes. Okay? So what's going to happen? We already said that they're going to go from a pallor color, they're going to have that trigger, so their fingers are going to turn white. Then they're going to be cyanotic, and then they're going to have your erythema. So they're going to have that white to blue to red, right? And this is indication of the blood flow from no blood flow, no oxygen, and then the blood flow returning. Their symptoms are then going to occur when that blood flow is going to start recurring. So what's going to happen here? So we have this blood flow that's going to increase, right? With that, they're going to have some of their symptoms. They're going to have pain, maybe that paresthesia, that numbness or tingling, pins and needle type of feeling. So they're going to have numbness. Because of all this, they may have some swelling. And the last thing is they're going to have possibly a decrease in their coordination. So remember, they're having this on their pointer, their middle and ring finger. They're probably having it bilaterally, and they're having this decrease in coordination, this swelling, this numbness and tingling. All of this is having problems with their proprioception, trying to do those fine motor, those tactile things that we're going to need a lot of sensation to do. So because of this, and it's occurring for 15 to 20 minutes, they may not be able to do some tasks that they're asked to do, especially if you're a nurse or any type of intricate type of tactile movements like putting in an IV. That's going to be hard to do maybe for 15 to 20 minutes because they're having this bilateral swelling, this decrease in sensation. So we as nurses want to make sure that we're telling our patients what are interventions that we can do for them, what are some things that we can teach them to do to help decrease all of this occurring. The first thing is typically for hands is to wear gloves. Okay? Don't go out in the cold without gloves. Try to avoid extreme temperature changes. They can also do socks if it occurs on their feet, right? Hats. And then if they have anything like a mask or a nose cover, a scarf to help cover up their nose, okay? So we want to decrease that exposure to the extreme temperature changes in the cold. What else can they do? We know that they can decrease smoking or stop smoking, okay? We talked about decrease the temperature changes. We talked about stopping smoking. We talked about stress. One of the things that the NCLEX likes to hit on is any type of stress relief like yoga or any type of reading, meditation. Oops, I almost put reading. I meant reading. There you go. Right? And then there's one thing we didn't talk on that technically doesn't fall under the trigger category, but can be things that we want to be aware of, is certain types of medications or drugs. And these are going to be ones that are any type of constricting, right? So methamphetamine, cocaine, or any type of medication that they're on that is causing them some type of vasoconstriction that could exacerbate these symptoms. Okay. So with that, you want to make sure you're talking to your patient, you're encouraging them to decrease or stop smoking altogether, cessation in their smoking, increase their stress release, so anything that is going to help them decrease their stress, and then to be able to put on gloves or socks, hats or mask to decrease that change in temperature. You want to also make sure when we're talking to our patients about interventions that they are doing things in a gradual manner, because they're having that decrease in sensation and they're having that decrease in their feeling and their coordination. You want to make sure that they're not doing things that can burn them or hurt them. So the NCLEX tries to trick you up and say, oh, put like a hot pad on them. You want to make sure it's lukewarm water and that they're not putting their hands in like boiling water or any type of heat pads, because we don't want them to be causing burns or any type of issues with their skin. All right, Ninja Nerds, that is our video on Raynaud's phenomenon. I hope it made sense. And as always, until next time.